name is Anna Sue Choate, and I'm going to be teaching you all about colic in horses. Colic is the #1 killer of horses. Colic is abdominal pain that is caused by multiple things such as gas, ingesting sand, excessive grain, impaction, or infection of parasites. Any horse can experience colic regardless of their age, breed, sex, or environment. The reason colic is so deadly in horses is because they can quickly twist their small intestine or their colon, especially if they have impaction colic. This causes great damage that is often unrepairable. I have owned horses for many years now, and the scariest thought you can have when your horse is not acting right is, what if she is colicking? I was faced with this past year, the day after Christmas, in my 2-year-old mare, Goldie. She was in training for a few months to jumpstart her riding career and had been there for about 30 days doing absolutely phenomenal, until we got the call saying that she was colicking and she was not responding to the pain medication and she was becoming worse by the minute. When we arrived, she was in very bad shape, sweating, rapid breathing, no gut sounds, which we checked with the stethoscope, and she could barely stand up. The vet came and immediately saw the severity of her situation. He used a process of nasogastric intubation where he placed a tube into her nose and down into her stomach to drain out the fluids. When the fluids started to come out, we knew the outlook of her survival was grim. Fecal matter was not passing through her intestines and had gone into her stomach, causing a lot of pain, but this was not the biggest problem. Finding this in her stomach meant that she had an impaction somewhere in her colon or small intestines, and impactions are deadly. Throughout this whole process, we're basically having to hold her up as she was becoming so weak she could no longer stand. Despite the bleak outlook, the vet tried his best to save her, and surprisingly, over the next few hours, she began to improve and perk up. By this time, it was almost 12 a.m., so we decided to go home and come back around 7 a.m. the next morning with a trailer to take her home. That next morning, the drive to the trainers, hoping to still see her gorgeous self standing up waiting on us, was the longest hour of my life. When I pulled into the driveway and saw her bright, kind eyes looking at me, my heart simply filled with joy that my best friend had defied the odds and survived her battle with colic. Through this, I was reminded of the dangers colic poses to horses. Understanding how to recognize, treat, and prevent colic in horses is vital to being a responsible horse owner and can mean the difference in life and death for your equine. As you saw in my story about my horse, a simple stomachache may not seem like much, but to horses it is quite deadly. The first step in understanding colic is to know what it is and how to recognize it. According to the American College of Veterinary Surgeons, horses that exhibit signs of a stomachache often look at their stomach, paw the ground, attempt to lie down and roll, sweat, increase their heart rate, pass little to no manure, quiver in their flank, groan, and kick their hind legs. While not all of these symptoms mean a horse is colicking, a mixture of these can create alarm for horse owners. Dealing with a colicky horse can go downhill quickly, and it is important to assess the situation and get in touch with your veterinarian. Thankfully, there are many different ways that colic can be treated, but you and your veterinarian must assess the severity. According to Malone, there are a few types of colic which can determine how the horse is treated. Impaction colic happens when feed materials build up in the gut and the horse has trouble passing it. Gas colic occurs when there is a buildup of gas in the horse's colon, which can cause the horse's colon to shift. If a horse's colon or small intestine becomes twisted, this can damage or kill the colon, and this can result in severe pain for the horse and death if not immediately fixed. There are multiple courses of action to treat colic. In the early stages, walking, removing food, and giving Banamine intravenously, which is a shot in the horse's vein of pain medicine that can resolve their stomach ache, can help resolve their stomach ache. In more severe cases, horses may need to be rehydrated with IV fluids, palpated or given a rectal exam, given laxatives such as mineral oil or Epsom salts through a nasogastric tube. In the case that these measures do not work, or if the horse has a twisted gut, surgery may be required to repair the damage to a horse's intestine or colon. Measures may be taken to prevent colic, but it is important to talk to your vet and research and know your own horse's needs. Colic is is caused by many different elements, such as excessive gas buildup, ingestion of too much sand or excessive grain, infestation of parasites, or ulcers. Colic can be prevented using very simple measures and changes to your horse's environment. The American Association of Equine Practitioners has a great article on colic prevention. A few methods this article mentions are establishing a daily routine, feeding a high-quality diet of mostly roughage, and a parasite control program, which is giving wormers every 3 months to the horses to control parasites. Along with regular exercise and turnout, reducing stress, and making sure fresh water is available at all times. If ulcers are a problem, supplements such as U-Guard can be given daily to help reduce the buildup of stomach acid in horses. Stress can upset a horse's digestive tract, so it is important to keep an eye on horses when they are exposed to higher stress environments. Overall, colic in horses can be a very stressful situation for the equine and its owner, but luckily there are ways to prevent colic. There are many symptoms and causes of colic, but thankfully there are several ways to treat and prevent stomach pain in horses. Understanding how to recognize, treat, and prevent colic in horses has saved the life of two of my absolute best friends. I am very thankful to have been able to take quick measures to help save my horse's life, because in reality, they have saved mine more than once. Thank you.